The arrival of the coronavirus in Connecticut certainly has a lot of us concerned, and that concern is even more heightened for those who are battling cancer. So here to talk about how treatments are and are not being impacted is Dr. Camelia Lawrence. She is the director of breast surgery at the Hospital of Central Connecticut and Midstate Medical Center. Doctor, thank you for being with us.
Good morning. Thank you for having me.
So as a surgeon, what precautions or changes are happening right now because of COVID-19?
Well, in addition to the CDC recommendations such as crowd avoidance, social distancing, washing your hands, as well as avoiding touching your eyes, nose, and mouth, at Hartford HealthCare, we've also increased the depth of knowledge for our staff regarding symptom recognition. We're screening all visitors and patients to our facility. In addition, we've converted several of our outpatient visits to the virtual health platform.
If you were scheduled for surgery, what happens then?
Well, since the outbreak, the pandemic rather, we have canceled all elective cases. So we're currently only operating on breast cancer cases, and those cases are still moving forward. In some situations, it does require dialogue with your treating physician, in particular the multidisciplinary breast team, to get a better understanding of whether your surgery could potentially be delayed. So we're really weighing the risk and benefits of both approaches.
And are breast cancer patients at a greater risk of contracting COVID-19?
A breast cancer diagnosis itself does not increase your risk of contracted COVID-19. However, for those who are currently undergoing treatment, such as chemotherapy and/or radiation therapy, the treatment itself does suppress the immune system, making you more susceptible to picking up the virus.
Is there extra advice? Many of us know people who are battling breast cancer. How do we support our family members? And if those people are listening, how do they best take care of themselves?
Well, I've been encouraging my patients in particular to stay calm, shelter in place, remain at home, only leaving for necessary doctor's visits for your treatment. And I've always also encouraged them to contact the office, speak to your doctor who can provide you with some guidance and perhaps some reassurance as we get through this period of uncertainty.
So if you're a mom and you're battling breast cancer, it might be hard. You're thinking, how do I shelter in place? I have to prepare meals for my family. Would you advise that they not go to the grocery store and that someone else make those trips for them right now?
Absolutely. If you are undergoing treatment and you are considered immunocompromised, the recommendation, if there's somebody that can go to the grocery store for you, that would be best case scenario and a preferred option.
Are there some things that people can do at home to perhaps brighten their spirits? I know people are looking for signs of hope, and are you advising your patients on how they can keep their spirits up as best they can?
I'm sorry, I did not hear that last question.
Wondering if you just have some advice to your patients on how they can keep their spirits up during this time at home.
Any sort of family bonding activities, I'd say, over the weekend in particular, I encourage my kids to let's do some baking. But if you're going through a cancer diagnosis, you may not have the energy to do all the activities that your children may want to do. But there's still some things, maybe reading a good book or a storytelling that you can participate in.
All right, Doctor, we really appreciate your time with us today, and thank you, and thank you to your whole team and everyone who is out there on the front lines during this pandemic.
Thank you for your time.
Thank you.